Hi everyone. Today we are going to cover Chapter 14, the endocrine system, diseases and disorders. So as far as the anatomy and physiology of the endocrine system goes, it mostly consists of glands. It includes the hypothalamus, the pituitary, the pineal, the thymus, and the thyroid glands. It also includes the parathyroids, the adrenals, the pancreatic islet cells, and believe it or not, it includes the ovaries and the testes. So each gland is unique and delivers a secretion into the bloodstream. Most of the time that secretion is a hormone, okay? And the way the hormones work is they work on a negative feedback system. And what this is, I can liken it to the heating system in your home. When you want it warm, say your house is at 65 degrees when you wake up and you want to warm it up to 70. You turn the thermostat, you press the buttons, and the heating system runs and runs and runs until it gets to 70 degrees. But once it gets to 70 degrees, it stops. So it sends a signal back to the heater and it says, hey, stop. And then it says every couple hours, hey, turn on so we can maintain, okay? So that negative feedback system, when things get to a certain point, you stop secreting. Same way as if your thermostat gets cold, or excuse me, you want to run your air conditioner. You don't want it to keep going past, say if you set it at 69. When it gets to 69, you want it to stop. So it sends a message back and says, hey, stop. Okay, and that's where the word negative comes from, is in stop. Okay, so there's two different kinds of glands. The exocrine glands we've talked about in a lot of the other chapters. These are glands which secrete products into ducts that lead to a target tissue. So your sweat glands, okay, when your sweat glands secrete, it leaves your body via your skin. So your skin is the target tissue. When our salivary glands are active, the target tissue is the food in our mouth, okay? In this chapter, we're focused more on endocrine glands, and these are glands which secrete products, aka hormones, directly into the bloodstream. And again, we talked about the examples, the pituitary glands, the ovaries, the testes. So we have lots of different diagnostic tests that we can use for our hormone levels, for our glands. The thyroid and the testes, these are the two endocrine glands that can be physically examined by touch. Okay, they can feel our thyroid in our neck area. Obviously, we can do testicle examinations, okay, but most of the time when we're thinking about diagnostic tests for them, we are thinking about using blood and urine to test for hormones. If we're worried about the organs that are producing those hormones, most of the time we would use a CT scan and an MRI. X-rays aren't real great because most of the time these glands are soft tissue and they do not X-ray well. Probably the simplest test I can give you an example for is a pregnancy test. We use our urine to check for the hormone that is secreted in urine. So that's an example of that. Probably one of the most ordered blood tests for the endocrine system would be thyroid levels. When somebody reports with tired, lethargic, they're just really exhausted, one of the things they're going to test for, in addition to anemia, is that your thyroid is functioning okay. So right now we're going to talk about diseases of the pituitary gland, okay? So the first one that I want to talk to, and you're going to hear me flipping my book because I always like to look at the book and go through things too, okay? So these are common diseases of the endocrine system, okay? The pituitary gland diseases, hyperpituitarism, too much, increased activity of the pituitary gland, okay? When there's increased activity, there's an oversecretion, and it affects growth hormone, which leads to excessive bone growth and tissue growth, okay? If it occurs before puberty, then gigantism occurs. So this is where people can be 7 to 8 feet tall. If it occurs during adulthood, acromegaly occurs. And what acromegaly is the large bones in our arms and in our legs can't grow anymore. Okay, there's just no more physical room for them to grow outwards. So the hormone affects the smaller bones in the hands and feet and face and pushes them out. So you will see people with gigantic hands or gigantic feet or an enlarged head, because that occurs after the large bones have stopped growing. So let's flip gears and go to hypopituitarism. Hypopituitarism, sorry. And this is an abnormal decrease in the activity of the pituitary gland. The symptoms: dwarfism. It happens, dwarfism can happen in a couple different ways. It can be genetically passed, but it can also occur when the pituitary is not working enough. Okay, it can cause abnormalities in the secondary sex characteristics. It can cause amenorrhea, which is when females do not have a menstrual cycle, which leads to infertility in adult females. It can cause lowered testosterone levels, decreased libido, can cause losses of facial and body hair in adult males. So when men have these things happening to them, they tend to panic and not want to talk about it. So that's why it's important for us to get the men in our life in to have a normal conversation, because these are things that can be fixed so easily. So both hypo and hyperpituitarism are diagnosed using pituitary function blood tests. The treatment for too low of an activity in your pituitary is hormone replacement. Then they monitor the replacement to try to get the right dosage so that it can make adjustments as they need to. Another disease of the pituitary gland is diabetes insipidus. This is not diabetes where we are talking about glucose problems. This is caused by a defect in the pituitary gland, or sometimes it can be caused by a defect in the kidney tubules. But what the defect does is it results in a decrease of vasopressin or antidiuretic hormone. Okay, so what happens is people are so excessively thirsty, they've been known to drink gallons and gallons of liquid, and they are urinating 2 to 15 gallons of urine in 24-hour periods. Okay, now 2 gallons doesn't sound a lot for those of us who stay hydrated and drink a lot, but this is when no matter how much they drink, they are still thirsty. Okay. When they drink too much, it results in a hypotension for their blood pressure. They get dizzy and they get constipated. Usually they present with excessive thirst and they're peeing constantly, but they'll tell the doctor, no matter how much I drink, I cannot get hydrated. Okay. They'll run a urinalysis, they'll do a water restriction test, okay? The nice thing about this, it's very easily treatable by using vasopressin, chemically produced vasopressin, and they also give you medications that lower your urine output, which helps to, in turn, get your blood pressure back to normal and things like that. So hyperthyroidism, okay? This is, now we're gonna switch to thyroid gland diseases. Okay, hold on, I'm going to drink a coffee. So hyperthyroidism, this is when the thyroid gland secretes excessive amounts of thyroxine. Okay, thyroxine is T4. There are a bunch of different thyroid hormones, but the big one for regulating metabolism is called T4. Okay. So the causes of hyperthyroidism can be a tumor, can be hereditary, excessive intake of iodine, which I don't know exactly how that would happen unless you drank a bottle of iodine, excessive thyroid hormone medication. So again, when people are taking thyroid medication, they're constantly every 2 or 3 months being monitored by lab work. And Graves' disease is also another common cause. So what Graves' disease is it's an autoimmune condition where the person's own antibodies stimulate the thyroid gland to produce more hormone. So it's just kind of an overproduction and an overproduction, and it just keeps going and going. So symptoms of hyperthyroidism: goiter, okay, that's when they can feel it in your neck; tachycardia, your heartbeat is very rapid, you're very nervous, you're hyper, but you overall feel very weak. You can eat a ton, but you're dropping weight like crazy, and excessive excitability. You can be real edgy. Some other symptoms is people will present with diarrhea. They will constantly be sweaty because they're hot all the time. Again, they're really thirsty, okay? You can see the medication is, they will always, always, always try thyroid medicine first. If that doesn't work, they can often try irradiating the person, and they can also try surgery to remove part of the thyroid. Another thing I forgot to mention in the symptoms is exophthalmos. Okay, I always have trouble saying that word. And that's where the eyeballs bulge out of the eye socket, not to the point where they're popping out. They'll just be protruded more than a normal person's eyeballs. So simple goiter, okay? This is basically just an enlargement of the thyroid gland. You can feel it in the neck on physical examination. It's caused by a family history, eating certain foods, an iodine deficiency. We all need a small amount of iodine in our body. We just don't need excessive amounts. So again, you can be very asymptomatic until your gland is quite large. Some people don't notice lumps in their neck. Some people do. So how they treat this is they give you a potassium iodide pill followed by increasing iodine in your diet. Certain foods are rich in iodine. The problem with simple goiter is if there is a lump in your throat, it can cause pain in the throat, it can cause pain when you're breathing, it can cause difficulty speaking. So they can decrease those side effects by removing it if it is too large. So hypothyroidism. This is a decrease in thyroxine, or that T4, okay? If you see hypothyroidism in adults, it's called myxedema. If it's a congenital hypothyroidism, remember congenital means we're born with it. It's a syndrome called cretinism, okay? So the symptoms for that are fatigue, sensitive to cold, very thin nails and brittle hair, excessive weight gain. Again, people will present, they just don't feel good. They're cold all the time. Their nails don't look right, their hair doesn't look right, and they're putting weight on and they're not changing anything in their diet. So again, we do some blood hormone levels and we treat it via hormone replacement. So we're now getting out of the thyroid and we're going to get into the parathyroid, okay? Your body has 4 parathyroid glands, okay? So they produce the para-hormones, okay? One of the causes of this is it causes hypercalcemia, okay? Too much calcium in the blood, which leads to kidney stones, bone weakness because it's pulling the calcium out of the bone, and hyperactivity of the heart. Because remember, the heart uses calcium and potassium to fire the heart muscle for every pulse, okay? But if you have too much calcium, your pulse is gonna heart's gonna fire constantly and you're gonna feel really rapid pulse. You're gonna really feel it in your chest. So they do blood tests for this. They will try to treat whatever's causing it. The prognosis is very good with parathyroid disease. The biggest thing is, though, that we want to prevent people from getting those kidney stones, from becoming osteoporotic, and from feeling those heart palpitations, which can then result in severe issues with the heart. So if there's a decrease in parathormone leading to low blood calcium, that's the exact opposite of the heart firing too much, okay? It's going to cause irritability in the muscles, which is called tetany. And it also causes uncontrolled contractions of the muscles in the face and hands, which is common. And so that it can be done. They do blood tests for this. Vostek sign is when they will absolutely, it's very interesting. They will stimulate the facial nerve and see if contractions occur. Trousseau's sign is when they put a blood pressure cuff on a person. And a lot of times if you have low blood calcium because of this problem, when they put a blood pressure cuff on and inflate it, it makes your hands go just twitch crazy. So that's Trousseau's sign. Okay. So again, treatments are they give you boluses of vitamin D and calcium. Once they get your levels to a manageable level, they may have you taking vitamins on a daily level, but they're going to monitor it via blood work. Okay. So the adrenal glands. These two glands sit atop the kidneys. Okay. They are also known as the suprarenals, or supra meaning on top of. Okay. There's two distinct parts. Excuse me. The medulla, or the inner, releases epinephrine and norepinephrine. These are our flight or fight hormones. And the outer is the cortex, which is controlled by ACTH from the pituitary gland. So here's where we start to see where one gland affects the next gland, affects the next gland. So the adrenal glands secrete mineralocorticoids, glucocorticoids, and sex hormones. So the biggest mineralocorticoid you need to know is aldosterone. Okay. The biggest glucocorticoid is cortisol, okay, which is also known as cortisone and hydrocortisone. Yes, our bodies make their own little bit amounts of those. And then the sex hormones are the androgens and the estrogens, okay? So when the adrenal gland is malfunctioning, we are not getting enough of these hormones, or if it's not functioning enough, we get an underproduction, okay? Now, what I want to tell you is, yes, our body secretes its own amount of cortisone and hydrocortisone to keep inflammation at a normal level. When we talk about getting cortisone or steroids as a treatment, okay, it's a synthetic glucocorticoid or a synthetic cortisone used to treat an inflammatory disease, okay? Whether it's an oral pill of steroids or it's a topical hydrocortisone medicine, they are only meant to be used for short term because they, in their own sense, can mess with the adrenal glands. Too much cortisone, okay, being produced in the body or being taken orally can cause hypertension. It can cause ulcers. It can cause moon face, and it can cause severe drowsiness, okay? The other problem is too much cortisone. It really suppresses the body's immune system, and it may mask symptoms of infection. So if you have a sinus infection and your sinuses are so inflamed that no matter, you know, they've given you the antibiotics, you're no longer massively infected, but if your sinuses are so inflamed, they're causing you massive headaches, or you just feel, you know, there's inflammation going on somewhere in the body, saying your bronchitis, that type of thing, they're going to give you a short term, or usually a 5 to 7 day course of steroids or synthetic cortisone, okay? The reason they only want to do that for a short amount of time is if there's something else brewing in you, the cortisone that you're taking for your sinus infection or your bronchitis may mask some other major infection, okay? So that's why they only give short-term doses of cortisone. So hyperadrenalism is an oversecretion of the adrenal cortex hormones. Conn syndrome is an overproduction of the mineralocorticoid aldosterone. These are not easy to say. And Cushing's syndrome is an overproduction of cortisol. So your body can present with any of these, but luckily the adrenal glands are real easy to test for. So if you have androgenital syndrome, this is an overproduction of sex hormones, okay? Hypoadrenalism, or Addison's disease, is low secretion of hormones by the adrenal cortex. So again, with the adrenal glands, remember they sit atop the kidneys, and anytime there's damage to the kidneys, there can be damage to these glands too. So that's why the first thing they look for is some type of significant trauma to that area, okay, before they start doing crazy tests. But almost all of these tests, again, can be monitored via blood tests. All right, now we're going to switch to the pancreas. Okay, the pancreas is the only gland we're going to talk about today that's both exocrine and endocrine. Okay, the islets of Langerhans, these secrete insulin and glucagon. Okay, insulin lowers blood sugar, glucagon increases blood sugar. So sugar or glucose, okay, is the primary source of energy for all tissue cells. So when we eat a meal, okay, it's putting tons of calories in our body, tons of carbohydrates, okay? If the body didn't secrete insulin, every single carbohydrate that we went would go into our system immediately, and it would make us crazy. We'd be hyper, you know, we would have some severe results, some severe negative results from that. But again, when you're not eating regularly, okay, your body secretes glucagon because it keeps whatever you do eat and increases that those carbohydrates, converts them into blood sugar that the body will use. Okay, so the first disease we're going to talk about is diabetes mellitus. This is what's commonly known as diabetes, okay? It's the most common major disease of this system of the pancreas, okay? It affects carbohydrate and sugar utilization because the islets of Langerhans do not secrete enough insulin, okay? The symptoms: a great amount of thirst, you're peeing a lot, people get dehydrated easily, or they suffer from ketoacidosis, which is when there's not enough carbohydrates in the system. So any carbohydrate that is in the stomach gets broken down. And one of the things what ketoacidosis does is it puts a real foul smell, almost like you've been drinking on your breath. So that's why when a lot of diabetics present, when their sugar's low, they will smell like they've been drinking, but they really haven't been. So there's two types of diabetes mellitus. Type 1, this is what's previously known as insulin-dependent diabetes, okay? It's the most serious type because it affects children and young adults, usually before the age of 25. It requires daily injections of insulin, and it is thought to be an autoimmune disorder. So these are the ones where these are the kids that get it, okay? These individuals do not secrete insulin, and their blood glucose control is very difficult. They usually learn at a very young age to follow a strict diet. They monitor their blood sugar levels. They administer daily insulin, and they are very well aware that exercise and stress can alter the insulin needs. Type 2 is formerly known as non-insulin dependent diabetes. This is the most common form of diabetes, okay? It's usually a gradual onset, occurs most often in obese females over the age of 40. It is now being seen more in younger obese people, but traditionally this is known as adult onset diabetes, okay? It is thought to be caused by the pancreatic islet cells of Langerhans just wear out, okay? When a person is diagnosed with this, they first try to control it with diet and exercise, and then they usually try oral medication to stimulate insulin. If they cannot, if the insulin levels cannot be adjusted and monitored with diet and with oral pills, that's when they will go to insulin, okay? There's a lot of complications with this because people don't test their blood sugar the way they should, and they don't administer their insulin, okay? A lot of people can't afford insulin, so they will ration it. They will ration their glucose testing strips, okay? So First thing you'll see when someone is in a diabetic coma, okay, is it'll be fairly slow progression. When they go in, their blood gets too high from them not taking insulin, um, it's going to get slowly, just going to keep going up, and that's why they say it progresses slowly. So this is a result of not taking enough insulin or eating too many carbohydrates. So you'll see polyuria, polydipsia, they'll be dehydrated, they'll smell like they're drinking, okay? So these are the diabetic coma for hyperglycemia, okay? If it's not put in check, okay, then they're gonna go into diabetic shock, okay? And this progresses quite rapidly. No, let me rephrase that. Diabetic shock is the opposite of a diabetic coma. This is when the blood sugar level is too low. Sorry, I was listening to something in my house and not paying attention. Hypoglycemia, this is when people give too much insulin to themselves, or they aren't eating enough carbohydrates, or when they have a stressor event. Okay, when they have stressor event, it can chew up those carbohydrates and they don't even know it. Okay, the symptoms: they're sweaty, they're lightheaded, they're shaking, they get into states of confusion followed by a coma, or they just pass out. Okay. My father, when he would get hypoglycemic, he was a diabetic like this, he would get combative, believe it or not. Again, the coma comes from insulin shock. That's a medical emergency. One of the first things we would do is try to put grains of sugar under his tongue. Once he got a little bit with it, we could give him orange juice, but if somebody's completely out, obviously you can't put anything in their mouths because you don't want them to choke, but we had sugar swabs we would do that with. If we had to call 911, they would have glucose injections that they could do it, but you have to be really careful because then it'll swing back the other way and get too high again. So some complications of diabetes are atherosclerosis in the heart, diabetic retinopathy, and kidney damage. So how do we diagnose this? They're going to do a history and a physical. The first thing it usually comes up is on a urinalysis. For a lot of people, you shouldn't have any glucose spilling out into your urine, but if your glucose levels are too high, the first thing it will do is spill out into your urine. So on a routine urinalysis, we can tell that. They can do blood glucose testing. We teach patients to do the point of care testing to monitor their glucose level with a finger prick, but they also try to monitor it every 2 or 3 months with blood tests. And again, there's no cure for this. The individual has to follow this plan of treatment for life. Gestational diabetes is one of the strangest syndromes that I've ever seen in medicine. It occurs only during pregnancy. It's usually uncovered because every pregnant woman, every time they go to the prenatal doctor, has to bring a urine. Okay, so they will find it. They also do a glucose test, glucose tolerance test on every pregnant woman, usually in the 4 to 5 month range of your gestation. And because if it's not caught, it can cause a lot of issues with the mom and with the baby. They will, of course, try to make sure the mom stays on a low carb, high fiber diet and gets plenty of exercise. But again, sometimes they just need to use insulin during the pregnancy. They'll use, like I said, injectable insulin, and it almost always disappears after delivery. What we are finding now, though, is that women are often affected later in life by adult onset diabetes, often had gestational diabetes when they were having their kids, okay? But again, no prevention, and there's nothing a pregnant woman does wrong, okay? For some reason, the body's hormones just tend to go wacky when you're pregnant, and this is one of the side effects. So, hypoglycemia. That term is used for an abnormally low blood sugar, less than 60. Okay, the symptoms are lightheadedness, sweating, the diaphoresis is sweating and trembling. Okay, so that's why, I'm feeling a little shaky. I better get something to eat. Okay, the only true diagnosis is to do a blood glucose test. Okay, treatment depending on the cause. We see this a lot in people who are getting married. They're a little nervous, so their stomach's a little upset. They don't eat much. Brides will faint. Um, and what happens is, oh, did you eat today? No, I didn't eat today. And top that off with being a little nervous sometimes, wanting everything to go correct. They'll get a little shaky, that type of thing. So that's why one of the things, when your mother tells you when you're getting married, did you eat today? That's one of the important things, okay? Hypergonadism. This is an increased hormone production before puberty, okay? So this is when in younger children we start seeing puberty, some things happen, and it's quite frightening when a 4 and 5-year-old starts to get some characteristics that we wouldn't normally expect in a 4 and 5-year-old. So the diagnosis, we will have them do blood tests for elevated hormones, okay? Then they'll try to find why, okay? Is there a tumor, okay? Or is that gland just functioning abnormally, and they'll try to give the opposite hormone to try to suppress and counteract the sex hormones. Hypogonadism is a decreased hormone production by the age of puberty, okay? And this is when normal changes that we expect in puberty don't start occurring, okay? So they will, if it's around the age 15, 14, 15, and things aren't starting to change in either a girl or a boy, they're going to do some hormone levels, okay? And this is very easily fixed. They can administer pills of estrogen and testosterone. So in each chapter, we always talk about what trauma would do to this system. So trauma, okay? A head injury can lead to multiple organ dysfunction. And when the organs start not functioning right, okay, the hormone levels are going to get affected. These are all things we almost forget about when someone's had a car accident or a head injury. We're more worried about keeping them alive at the beginning, but then a lot of times hormone imbalances occur in brain injuries because the organs are affected because they're not getting the right signals from the brain. Okay, so they have to, long term, they have to worry about organ destruction and failure because this can be life-threatening. There are some rare diseases of the endocrine system. They're very uncommon. The most common ones are thyroid problems and diabetes, okay? And lastly, we always say, what are the effects of aging on this system, okay? When you're older, you start decreasing how your glands work. So the secretions decrease, okay? You have a lessened glucose tolerance. So you're a little more susceptible to hyperglycemia and hypoglycemia, okay? We have digestive and metabolic problems, okay? So if someone's not eating enough, they are not getting enough carbohydrates to fuel their system, that causes a glucose problem. Or they're sedentary and they're not active, so they are hyperglycemic, and that can cause diabetes mellitus. Diabetes mellitus is a very common problem in our older population, especially as we see the number of people over 60 increase. We are seeing a lot more diabetics in our society, and you can see this via the advertising. There's a lot of drugs that are being targeted to diabetes mellitus. They are offering once a week injections now. They are doing insulin pumps. They've been doing a lot of studying about this. So that is it. So have a great day, and I will talk to you later. Bye.